Mental health is a growing concern in the pandemic, with as many as 75,000 Americans at risk for overdose or suicide. I'm joined by Patricia Reamer. She is a senior vice president at Hartford Healthcare and the president of the Behavioral Health Network. Thank you for being with us.
Sure.
So what are your thoughts on that very startling number?
Well, it is a startling number. I think that there is growing concern that as perhaps some of the COVID crisis diminishes just a little, that people will have more issues with things like being laid off from a job or losing a job or being isolated for so long. And we are concerned that people will be more depressed, more anxious, and can turn to suicide. I do believe that if we are aware of this and try and intervene with it and try and communicate to people that there is help available, that we can decrease that number.
Who do you see it having the most negative effect on right now?
That's a little bit of a toss-up, Cara. I mean, I think that the elderly are having a lot of trouble because they are so isolated. We understand that children and adolescents, the schoolwork is very intense and that they are struggling as well and are struggling with being kept away from their peers. And then we have individuals who have lost their jobs and really don't know when they will be able to return to work. And then we have individuals who have lost loved ones. So if you put one or two of those together, somebody who is working but has lost a family member and is experiencing perhaps some financial difficulties because their spouse is not working, you're putting people at increased risk. And so it's hard to say that one group of people is more at risk than others. Clearly, people with behavioral health issues prior to this, we are anticipating maybe struggling and reaching out to them very actively.
We know that people have never needed help before, probably do need it now. What type of treatment are you offering, and how can people get it?
So Hartford Healthcare's Behavioral Health Network is open and accepting referrals. We are doing evaluations of new people. We can do that either through telehealth, or we do have staff members that are available to do face-to-face, either evaluations or admissions to an outpatient clinic or to a program that somebody may need. So services are still available and across the Hartford Healthcare Behavioral Health Network, and people should definitely reach out if they are feeling like they need to speak with somebody, they need an evaluation, they're increasing their substance use. All of those things are things that contribute to suicidality and are of concern to us.
Patricia Reamer, thank you so much for being with us. We appreciate it.